Hello, everybody. It is Dr. Mary Gardner at Lap of Love, and I have a special guest today, Dr. Carmen Colitz, ophthalmologist extraordinaire. Let me put your name up here with all your beautiful digits and letters and stuff like that. How are you?
Great. How are you?
I'm so good. Thank you for coming. So in honor of our lecture today, I've worn my crazy glasses. Because we are going to be talking about eyes. But
there's nothing else, just eyes.
Just eyes, right.
Is.
So I love this. I'm going to put them on my dog right now. So thank you so much for jumping on. And I've got, sorry that we are a little behind, but everything looks good. I've gotten a message that we're all clear. I got a new laptop, so I was struggling a little bit, but thank you for joining. So I wanted to talk today about vision in our older dogs and cats and what we might see commonly. So you are an ophthalmologist, and I know a lot of people don't realize that there's boarded specialty in veterinary medicine. And so can you explain all your little numbers, digits after your name there?
Yeah, so it's a process. So we're going to assume that everybody understands we're both veterinarians. So we both went to 4 years of undergrad and then 4 years of veterinary school. And sometimes people do things in between before they get in. So we've accomplished the DVM part. Then specialty medicine has been around probably maybe 40, 50 years, believe it or not, just not in the way it is now. It had to evolve from like a handful of people till they created their different colleges. So if you name the specialty you have for people, we pretty much have it for animals too. Yeah. So I happen to be an ophthalmologist. My husband's a surgeon, mostly orthopedics. There's internal medicine, behavior, neurology, dermatology, you name it. So
wait a minute, your husband's a veterinary surgeon?
Yes.
I didn't know this.
You didn't? Don't you know Dr. Latimer?
I do. I didn't know though. I love it. Okay.
Yes, exactly. So in order to get a residency, that's where the hard part is. Yeah. So there are so many young people who want to become specialists. It's very difficult. So you have to do sometimes some things that are extra, like I did. I went and got a PhD to position myself to become what I wanted to be. But not everyone has to do that, you know. Okay. So there's other ways now. But so I did a PhD in molecular biology, basically cancer biology and embryology, development of the eye, in order to attain my goal, which was to get this residency, coveted residency. And back then there was like 3. Now there's like 20.
Yeah.
So thank goodness I got the one I wanted. It's a 3-year program where you're only focused on that specialty, and you're trained by specialists who are excellent in what they do, because ophthalmology is cool because it's both medicine and surgery. So we can actually fix things sometimes rather than just manage them for life. But sometimes it's both. So after that, then I became a faculty member for a long time, first at Louisiana State University and then The Ohio State University.
The Ohio State.
Yeah.
So I'm of course a Gator.
Yeah, go Gators. That's my undergrad.
Oh, okay, good. All right, cool. So, and listen, if anybody's out there, they can always shout out where they're from. So I have a little comment box so I can see this. So needless to say, you are an expert on eyeballs.
Yes, I would probably finally, after 30 years of doing this, say I am an expert on eyeballs.
I love it.
It took a long time to believe.
Listen, as a general practitioner, I used to always refer to the 3 O's: onco, ortho, and ophtho. So you and your husband carried like both of those for me. I love it. Okay, so, you know, we met. So for those of you that don't know this, we are actually a few miles from each other right now. So you practice really down the street and from me. And I brought to you my dog recently, like maybe it was a year ago. And so I think it's really important for everybody to know this fact, which is super cool, that you can tell the age of a dog, or a cat too, maybe. You'll have to tell me this. Mm-hmm. Yes, cats too. Okay. By the lens. So a structure in the eye more accurately than dental like looking at the dentition, right? So
all day long. Yeah.
All day long. Okay. So I adopted this dog, Norin, 3 years ago, and they told me he was like 4 or 3 at the time. Right. So, so last year I brought him to you because I thought he might have had a little vision issues. You said no, but you were able to age him for me. And you,
what did I tell you compared to what they told you?
6 to 7. So he was a little older, but for those of you that know me, I like older dogs and cats. So the older, the better. So it actually gave him a plus in my mind. But a few years less than maybe I will get to spend time with him. So that's okay. But that's super interesting. And I know that apparently us regular veterinarians can figure this out too. I don't know. So, so a veterinarian could look at the lens and age a pet more accurately, which is super cool. Okay, so Dr. Carmen, what are those who are watching or normally have old dogs and cats? And I wanted to cover maybe the top 3 things that happen as pets age in with the eye, and what and then also what can we do to help them and maybe prolong better vision. So. The first one I always think about is nuclear sclerosis.
Yes. So as you've already mentioned, the lens. So the lens is a M&M shaped structure that sits inside your eye behind your pretty iris, whether you're blue-eyed or brown-eyed or hazel-eyed. So it stands upright inside your eye, and its job is to focus incoming light to the back of the eye called the retina. In people, it's the macula. We've heard of that structure. In animals, they don't have one. It's called an area centralis. And then it goes to the brain where magical things happen, and then you see. That's how I really see the whole phototransduction vision thing, because it's really complicated. But I
like magic.
It happens, yes. Right? So if you're lucky enough to have good vision, great. If you're not, and you have to wear glasses or whatever, great. We have the technology. So that lens over time, as you said. So when you're a little bitty fetus or embryo, it's basically the peanut of the M&M and a candy coating.
Yes.
Okay. And when you're born, that's where you start. That's like age 0. And as you age, you lay down the clear chocolate fibers around that peanut M&M, around the peanut. And so your lens grows throughout your life, but it has to stay condensed in a certain size, right? Because otherwise your lens would be the size of your head. Because it does grow throughout your whole entire life. So at some point it reaches that mature size, which is about 2 to 2 years old in animals and about 20 in people. Then those fibers still keep being made, maybe not as quickly as through that first 2 or 20 years of life. So they get condensed, and they start condensing that peanut. So now it's going to start refracting light. And that's about age 6 or so in a dog and cat, and about 50 or 60 in people. And that's lenticular sclerosis or nuclear sclerosis. I like nuclear sclerosis because it really does talk about the nucleus of the lens, and that's the peanut.
Okay, so better that I say that. I'm going to use it better. Okay.
I like nuclear. Everyone who's taught is taught differently. They're both the same thing.
Okay. Good. I like this. So, right. So it gets, because, the lens is sitting in a ball of goo, right? And it can't get bigger and bigger. So it just gets harder. And
yeah.
So does that lead to complete blindness though? Like, does it affect their vision, blindness?
No, it doesn't cause complete blindness, or it should not, because it will refract light. And in people, the reason we get cataract surgery at 60 or 70 is because we get glare at night, because the lights are going through that nucleus and it's really annoying. Yes. So people have cataract surgery for lenticular sclerosis because it's annoying. But animals who can't tell us that it's annoying because they're not driving out on the street or doing things that probably require some, require thumbs. Yes. Their lenses get more dense, but if you can see through them, or if I can see through that during my exam to the retina, then it's not impeding their sight. Right? They're just not seeing things up close. Like us, after 40, right? Everything, you get that long arm disease and we're wearing glasses, but I get that a lot. My pet can't see the cookie in front of his face. I'm like, because he's over 40. Like, he's got presbyopia. So hold it further out and then he'll come to you.
Okay.
They
So
age like us.
That's pretty interesting. So maybe hold it further away. Up close, they can't see.
No, it's really blurry like us, right? Like I do that and I'm like, whoa, that's really annoying to look at something super close.
Totally learned something new. This is why I like to invite smarter people than myself onto here. So
I'm obsessed.
This is so cool. So if you do have a dog with lenticular sclerosis, and now I said lenticular, I wanted to say nuclear. And if they might have trouble, maybe it's because you're too close. Hold the treat further away.
That's one possibility.
One possibility.
So, yes.
So we don't really do anything for that, right? Like medically.
No. Now, at some point, if your pet is unlucky enough to have some oxidative stressors in their life, like other systemic diseases or reasons to age faster, and the eye is the one place you can see that happen, right? You can't really look in and see how your kidneys are doing other than ultrasound, but the eye you can see. So that lens is gonna a lot of times show the wear and tear of your body through it. So it may get denser sclerosis faster than it would have if that body had been lucky enough to be really balanced throughout its life. And so you lose your antioxidants in your lens, people do, at the age of 40. That's been shown. So they're gone. So replenishment's important. So I, in my mind, think, well, 5 is about 40 in a dog. So I think we should start replenishing them earlier, so that they never get depleted of their antioxidants and their lenses stay clearer, healthier over time. I mean, they're going to get sclerosis because aging is a thing, but what you don't want to do is have that so it gets so dense that it does impair their sight.
Okay, so the antioxidants will help that.
Yes.
Okay. Yeah. Okay. So I want everybody to mentally, don't forget that because I want to talk about that.
Very important.
Okay. So now, what's the other big disease that dogs and cats?
Yes. So this is one where the general veterinarians see the sclerosis and chalk it all up to that, but they're not doing a good retinal exam because they don't have the toys I do, right?
No,
so
you got some cool toys.
Yes, and we use them to their full ability, and so this is where a specialist is a good person to go see just for a wellness exam every so often, just like you or I go to the eye doctor.
Yep.
So the retina naturally will start aging around 9 or 10. And that means that night vision starts going down in most pets with time. And that's assuming they don't have an inherited disease called retinal degeneration. The all-encompassing term is progressive retinal atrophy. And a lot of dogs will have it. They don't have to go completely blind, but they'll have some semblance of it early on. And until it's really advanced, the owner doesn't notice. And by then, all we can do is keep what we got, which is minimal. And then the vets chalk it up to the lens.
Yes.
But it's really the retina that's doing the bulk of the degenerating.
And there's certain breeds that are more predisposed to this.
Absolutely. There's about 100 breeds, but there's one breed I see it all the time, and it's a Shih Tzus, because we see so many Shih Tzus. And last time I checked,
we are
Shih Tzu country. Oh my gosh, they're everywhere. And so they have so many eye problems. They're one of 2 breeds that have the most eye problems of all.
Okay.
And this is when I see them young, their retinas are already going downhill.
Wait a minute. So this is trivia. Shih Tzu and
Boston Terrier.
Boston Terrier, which is another
they have so many issues.
Which is another. We could play the breed game, can't we? So we know what would see you and what would see your husband.
Oh yeah, no doubt about it. Those 2 are in and out all day.
I love this. Okay, so we've got the nuclear sclerosis, the retinal degeneration. What's another big one?
Another big one is dry eye disease here in Florida. We do see that just as just living in Florida, and that can be any age, but as they get older, it happens. And then indolent ulcers is a type of corneal ulcer entity that's spontaneous and is associated with dogs at average age of 9. And of course, boxers. Boxers can do it kind of younger, the boxer ulcer, but it's the same entity. And we see this. I literally go up to the pet, I can tell, and I go, this dog is 9. And the owner goes, how do you know? Well, because it has this type of ulcer. And it's clockwork. My own dog did it when he turned 9. And I'm like, and it's spontaneous. It's like, boom, you didn't have to do anything.
And it's painful, and it needs to
So
get
painful.
Super painful.
Yeah.
Yes.
Yeah.
So what about cataracts?
So cataracts causes, so the main causes of cataracts, the ones we see that need surgery are inherited cataracts and diabetic cataracts.
Yes.
And that's, yeah, as soon as a dog gets diabetes, I feel that they should come to the eye doctor right away, because we have to start managing the things they're going to get. Because every diabetic dog will get a cataract.
Every diabetic dog will get it.
Everyone, 75% within a year, and then the rest soon after.
Wow. Okay. So is that true for cats too?
No, cats don't have the enzyme that dogs do, so they don't get diabetic cataracts.
Okay. This is like, I'm so learning. I'm going back to school. Okay. So I had a Samoyed, let me see, that was her picture, who had diabetes. And this was, when she's an angel now. So it was a while ago. And so I knew she got cataracts, and she was probably about 10. And I saw, Dr. Carastro down in Fort Lauderdale area.
Yeah.
So I had them removed, and it was, a lot of eye drops, not going to lie, a collar and she looked ugly because they shaved her face, but it was like night and day days later. Like, she wasn't tripping over things. And so I know a lot of people are scared to get cataracts or, getting this surgery, and especially if they're older. And I have another video that I did on safety and anesthesia for older pets, so people can go back to that, which is great. But let's say someone cannot get them removed, financial reason, whatever it may be. Maybe the pet is bad. Should they still do something? And that's where I worry about. I think it's pain. It's not without some problems, right?
That's absolutely right. Yes. So cataracts, whether they're inherited or diabetes or age-related, they need anti-inflammatory eye drops.
Okay.
Because cataracts, even early cataracts, will be causing inflammation inside the eye, and it's not obvious. Like, nobody will notice other than things happening inside. And over time, that predisposes to painful things. This is what I tell owners. This is where you don't want to end up. Painful things include glaucoma, horribly painful, dreadful disease, migraine headache. Second, the lens itself is held in place by these little tiny structures around it, 360. Those get broken down by that chronic inflammation. And then the lens has two options. I go forward into the front of the eye and touch the cornea, and that hurts like crazy. Or it goes back, which doesn't hurt, but nonetheless, the whole falling out of position isn't great. And then that chronic inflammation too can over time become uncomfortable. People say they get a brow ache or they don't feel so good. Doggies they're troopers, they're predators. They're not going to be like, oh, I have a headache, so unless you're a Shih Tzu, but they might do that. But everybody else is tough.
Right. Maybe the Shih Tzus. I'm only kidding. Lisa's got a Shih Tzu. I had to throw it out there. So now
they're super cute, but they can be dramatic.
Please don't hate me, Lisa. Okay. So, so it does increase the pressure in the eye too? Over
time it can, because it causes a membrane over the normal outflow tract inside the eye. So it clogs the drain.
Regardless, you've got a dog with cataracts, they should be on anti-inflammatory drops.
Yes.
No
doubt about it.
Okay.
No doubt.
I kind of knew that, but I thought, do I have to wait for a certain period of time? Let's not wait for bad stuff to happen, because I don't want it wobbling, like you said. Okay.
Yeah, you don't want any of that. All that hurts.
All of it hurts.
It hurts. That's where you don't want, if you can't do anything about it, it's okay. But pain is where people don't want their pet to hurt.
Okay. This is so helpful. So, because we have a lot of patients with a lot of dogs with diabetes, and I've had my plenty share. So what if, because I know, like, what if you've got retinal degeneration and cataracts? You could still, if you don't want to do the surgery, you could still do the drops. Like, it's
absolutely. And retinal degeneration can cause cataracts. So, yeah, it's a toxic cataract, because that lens dying releases toxins, it's believed, and it hits the lens, and then it gradually gets this very classic cataract. We can tell when we look at it, and then over time it'll get worse and progress. And so once we get to talking about supplements, there's things we can do to actually stop the progression of that, to get the lens all, imbibed with antioxidants again. We can do things.
Okay, this is so important. All right, so now, what is like one or two or whatever things you wish people knew about, like with their dogs or cats with eye issues or aging eye, whatever? Like, what do you wish your message could be out there?
Oh, I wish the message could be, don't be afraid to go to the specialist. We're not that expensive. It's you get it's whatever the initial fee is, but you get the full exam. You get the health status of the eyes of your pet. You'll be able to manage things better earlier. And that's the key.
Yes.
Because so many times I hear, well, they started going blind a year ago, or, my doctor did say to go, but, I didn't know if they were serious. And I'm like, they don't just tell you this because it's a suggestion. Like, maybe you should go and at least get a baseline. Like, we would go, right?
That's
and
what
granted,
I did.
I'm not the best for myself.
Yeah, that's what I did. Like, I am a veterinarian, and I brought him to you because I'm like, let me bring him to the best and get the baseline, get him all looked at, because like you said, you got the tools. You also, this is all that you do. Like this is what you see. And there's things that I do all the time that, dare I say, I might be good at. And this is your jam, is the eye. Definitely.
Yeah.
So, we have a few questions, because then I want to ask you some more, of course. So we've got someone from Boynton Beach, Florida online. So we are in Jupiter, Florida, so not far from you. So somebody's just thanking us for our service. Thank you. You guys are great. So Amber lost her 14-year-old Shih Tzu. She wanted to thank Dr. Daniela in Phoenix, and he only started to have eye issues in the last year of his life, and she was diligent about cleaning his eyes. And that's the Shih Tzus, but it's good. We might need some eye drops and things like that. So it's very good to get them looked at. And Lisa's got 2 Shih Tzus, like I said. I love this. So if a dog or cat does start losing their vision a little bit, what are like some things to be mindful of in your house besides medicine? Like safety, I think, is a big one.
Yeah, for sure. Like, so once we figured out the why, is it helpful or not? You've got some answers. Now, safeguard your home for the things. So around in Florida, we all have pools.
Yes.
Please don't go out there without, go with your pet. Make sure they're safe. They don't fall in. You think, well, they should be able to smell the pool. No, they literally just don't. And one little misstep and they're in, and they may not be swimmers, or, it's a terrible heartbreaking way to lose your pet. It's awful.
I know. And you have an emergency clinic too. So, you see it. When I was in GP too, we saw it way too much with these guys, with these old guys. And then you add on things. They've got decreased vision, decreased hearing, mobility issues, cognitive dysfunction. And even my girl, everybody knows my girl, Sam, I let her go on Valentine's Day. She's an angel since Valentine's Day, but she had spinal lymphoma, so very wobbly mobility issue. She was at the physical therapist 3 times a week at your place. So she was well-known there. But she kind of tripped, her little toe caught and poof, right into the pool. So you always have to be with them. Even if you think you're the best mother, stuff happens. And
I'm out there anyway, even though mine are okay. Right. I don't let them go without me.
No, exactly. So that's so Lisa said she lost a dog in her pool, and you don't want 100. Yeah, it's horrible. So that's important. I also think, Dr. Carmen, also what I see a lot is that older dogs or cat, mostly with the dogs, if they start to lose their vision and their hearing and stuff like that, and if they are painful from, let's say, arthritis, toddlers and kids in the house don't understand when they're approaching the dog and they don't see very well or something like that. So it's sort of like safety with how you handle that and make sure they see and hear them. Yeah,
respect, the children young people should respect the pet. Like, they're not going to move out of your way. They may nip at you, and they're not being mean. They're just protecting themselves. And, or like we would yell at somebody like, don't touch me. They have no other way but to just nip or bark. And so they just have to be respected. maybe put a bell around the other pet's neck so that, or even that one, just so everybody knows where everybody is.
I love that
We've
idea.
done that.
Yes, like
Yeah.
all the other pets get the bell so that they can hear them, and be gentle with
Now, if
them.
they're deaf, they should wear the bell.
Exactly. And also just safety, like don't move the furniture like
right
away, give them time to
Watch
activate.
the stairs. Yeah.
Stairs or something.
Yeah, I have a lot of stairs, but still.
I always, like baby gates are great, but I love tension rods because you can put them anywhere on, banisters of stairwells and stuff like that, just to keep them safe.
That's smart. Scents, they still should have a sense of smell. That's very unusual to lose that.
Yes.
Because it'd be a bad disease if you did. Put scents around the area, like your food is in this area, or textures for their feet, runners, things like that.
I love because they map their place so well. So I used to, they've been on backorder for a while, but maybe they're off that. Trackers, I think, was a scent company that was really good. So they had little discs, like felt discs that you put scents on, and you could put them around your house. So
that's cool.
A lot of stuff's been on backorder, as we all know.
True.
So I want to go back to this topic of antioxidants because I need to talk about something very important. So I want to talk about your supplement, and I've been starting to use this with my boy Norin because now that I know he's 7, but I might have should have been starting this sooner. Is OcuGlow?
OcuGlow, it's our baby. Yes.
Tell me more about this, and I'm going to put a website. I made my own little thing to show everybody here. OcuGlow.com, not glow with a W. Tell me about this, Dr. Carmen.
So this, I will take no credit for the idea. My colleague, also a veterinary ophthalmologist, had this great idea because we were, almost 20 years ago talking about putting little dogs or big dogs on supplements because they would get inherited retinal degeneration, diabetes, and their cataracts, just normal cataracts. So I knew from my background, after my PhD, I did a lot of antioxidant research with the lens. And we know that they get into the lens, and we know that we can slow some of that natural aging. So I have always been a big proponent of supplements, even for myself, like for the past 25 years. So we were sending people to the health food store to get supplements that were people-sized for these little dogs, right? And it's really hard not only to get the right amount because you can overdose them, or the dog just doesn't want to eat it, which has been, some dogs just won't eat whatever you want them to eat, no matter what you do. But so she said, I want to make this product that's safe for pets of different sizes, and I want me to make that recipe. So it was quite the honor. So I got to do that. I already had it actually pretty much spelled out what my perfect world would be if I had this. So the GLO in OcuGlow is grapeseed extract, lutein, and omega fatty acids. Those are my top 3. Yeah. I don't go a day without, actually, I take the human version of OcuGlow, which we have. So yeah, it's evolved because I have a family history of macular degeneration. So when I made the canine version, the one in your hands, I've been taking that forever till we had our human version.
I might text you later
because
I am like you. I take about 50 supplements a day.
Yeah, it diminished the amount because now I added other things because I love to try different ones. Yes. But when we created OcuGlow, I wanted to definitely target the diabetic animals and the inherited retinal degeneration animals. And now we know it also helps glaucoma animals because it helps protect their optic nerves and retina. So all those different antioxidants are working in different pathways. There's different pathways that antioxidants take to help relieve the oxidative stress in our bodies. And because if you just did it in one way, they're going to find another way to get stressed. So you have to get them in different ways. And that's where the multicolored fruits and vegetable concept, if you're eating the right way, which most of us don't, that's why we have supplements so we can cheat in essence and then still make up for it. And then you go, well, why would my dog who's getting this great dog food need anything more?
Great question.
Well, I get this asked all the time. And I will say, well, think about it. Back in the wild, if you let your dog eat naturally, sadly, they'd be hunting, right? So I feel bad for the little creatures, but they were little herbivorous or vegetarian creatures they were eating. They were eating birds and they were eating little bunnies and, little I don't know, whatever rodents eat, but whatever it is, they may be having a variety, a squirrel here and there of animals. They wouldn't be getting the same exact diet every day. And then to top it off, the pet food industry, who will probably not like me for this comment, we've created this convenience of dog food, right? So you just get a bag and you pour it in their bowl and it's there. And you can have like not the best quality all the way to what you believe is the best quality. So the majority of them get cooked to the nines. So all the antioxidants that might have been in there get depleted because they just cook them. So there's newer ones where they steam them or they bake them. So they're more preserved in those kibbles. Or then you have the wet foods or the raw, freeze-dried raw. Like I love the whole gamut. I feed raw to my pets, believe it or not.
You do?
I do. I love the raw food diet. I'm one of those rare veterinarians that
you're very rare. Yes. Okay. I actually get I use Farmer's Dog, so it comes in a pouch and it's fresh and so
yeah, that's a good one.
Okay, good.
And I like to vary. I'm like, I get bored, they should get bored. So
totally. Yeah, exactly. Mm-hmm. Okay, so regular dog
back
food.
To the antioxidants.
Back to get me back on track, Dr.
Back to that. Sorry, I derailed. So yes, the whole antioxidant. So even if you had the best food, you're still not going to have the plethora of antioxidants you could get by taking a separate supplement, right? So that's where we come in. And it's not just for eyes. I do, as an ophthalmologist, all I believe in is eyeballs, but that's not true. I know that there's cells everywhere, and a cell is a cell. And they're all being depleted and bombarded with UV light, with the air we breathe, with the pollution, with the food that we eat, which may not be all that good for us, natural aging, because we can't escape it, and disease, right? Chronic diseases, acute diseases, they're depleting your antioxidants as you go. And if they depleted your last one and you didn't take more, you're going to succumb to faster aging and maybe be more prone to other diseases. So
these will help bombard for a lot of things.
For a lot of things. And I've been tooting the horn of natural aging and being on that for lifelong, because my little dogs, of course, have been put on it since the minute I got the dog. Because they're about to be 15 little dogs. They're precious. They go for 3-mile walks without any hindrance. They catch treats in midair still, which I don't see in regular 15-year-old dogs.
No.
They still see at night, which is amazing. They've not missed a day of OcuGlow in their entire lives.
And you could look at their eyeball and say that it's fine and all the insides. So if anybody's going to give them a gold star, it's you.
I'm so impressed with it.
So could we start this like super early? It's not like, so if you've got a 1-year-old dog, start it.
Yeah.
Why not?
Okay. My French Bulldog, because she's an hybrid, I started her at 8 months.
Oh. Yeah.
That's one of my only 2 dogs that, as a puppy, I got them. The rest have been older, 1 or 2 years of age, but all my dogs, as soon as I get them, because you don't know if they're rescues, like what kind of life did they have before? You don't know.
You don't know. Hold on. Do you get dogs that are going to have eye problems? Like are you a sucker to those?
No, but I love Frenchies. So we have 1 Frenchie and the rest are just a variety of things.
Okay, good. So I wanted to show everybody, this is, I've got the medium to large size dog breed. So there's my little, so you can see how tiny it is.
It's a gel cap. It's a smooth gel cap.
It's a little gel cap, yes. And you've got the little chart on it, and I've got the website there so people can see. And you also have this for cats.
We do. So that was the original formulation that you have in your hands. There's tomato extract. That's one thing called lycopene that's in there because it's good for cataracts. But we, over time, figured out that the occasional dog will get nauseous, as humans do. It's a nightshade, and some individuals don't tolerate tomatoes. Who knew, right? So a few years ago, we came up with a second recipe devoid of tomato, and instead it got replaced with astaxanthin. And astaxanthin is what makes lobsters and shrimp pink. And it goes to your skin, and it's really good for your eyes too. So we have a capsule with powder in it and a chewy. That's the small one of that. The small size of that one can be used for cats if you can pill your cat. So many people can't. I'm very good at it, but most people don't want to do that. So we now have a chewy that can be dogs or cats. And we have a capsule with powder, and some cats will eat the powder in their food.
Okay, great. And all this is available on the website, oculo.com. You can also get it through Amazon, right? If somebody, or Chewy.
Yeah, many of them. Yeah, the Chewies are sometimes on Amazon. The capsules and the or original that you have in your hand is on Amazon. Chewy.com for sure carries them.
Okay.
And Animal Necessity. Yeah, animalnecessity.com is our manufacturer distributor. It's all one word, Animal Necessity. You want to add that onto that?
Yes, Jamie's going to put it in the comments there. Animal Necessity.
Yeah. So, and there we have other amazing products as well. Everything is top of the line ingredients. I mean, we have a nice anxiety product that I love. We've got a kitty and dog one. It's Shauna, and I'll just kind of plug a few of the other products while that gets put up there. Shauna has 2 main ingredients and others, but one is an anti-yeast supplement. So I use that for all my bulldogs. My Frenchie is on that because some breeds are very prone to yeast infections, just skin and eyes and ears because they're allergy breeds. And it's also got Abreva, which just goes by Docosanol, but most people will know it by Abreva, the cold sore stuff for kitties with herpes. And pretty much most cats carry herpes and they can have drainy eyes. So that's an amazing product for cats and yeasty dogs. Immuno's an immune product. I mean, I use every single one of our products in a variety of different ways in my pets and myself.
I love this.
And Joint Guard, our joint products like the Balm. It's great for pain too.
Your joint products. Okay, and that's all on the Animal Necessities. And Jamie's put it on the she put it in the comments already. So
great.
I get help. I need help in life. So she's there helping me.
Thanks,
okay,
Jamie.
so Lisa's got a question. I got 2 questions that I see. How do you know if they're having eye issues?
That's a great question. Okay, so I'll start with some subtle ones where people aren't sure if it's their eyes or their joints. They don't want to jump off the bed or they don't want to jump back on the bed. And sometimes they'll notice that it's at night versus in daytime. So that's one that'll give you the clue of vision because they're losing their night vision. Another one is, I mean, other than blatantly running into things, that's like the extreme, right? That's acute vision loss. If they're doing it gradually, you may not notice. Right. And I've seen dogs that are like this close to blind and the pet owner never noticed because they did so well because they're super smart. They're predators. They're not going to show their weakness, right? Because T-Rex will come and get them. So they still are, that prehistoric brain is still there. So they have to protect themselves. Other things, they may just miss something, like say you just put a suitcase down that hadn't always been there and all of a sudden they bumped into it. Like, that's kind of interesting. I've never noticed that. Up north, falling off the deck, or the stairs, that's sad. Like that's their version of the pool for us.
Yep. And of course, eye squinting for pain, that's.
Of course.
Yeah.
And sometimes it's even more subtle. It's just drainage, and they didn't realize that just draining is pain. It's new. And I want to make one comment earlier where cleaning the Shih Tzu's eyes, no pet should really have excessive discharge. You shouldn't have to clean your pet's eyes every single day for the most part. I mean, there's some dogs that just do because they have hairs in the corner, but you at least want to rule out dry eye disease or extra eyelashes or something that can be fixed. People don't realize, they shouldn't have copious boogers every day.
Okay. It's good to know. So then Lisa continued, is this something you could look for or left up to your veterinarian? So we answered that. It's a lot of times, you guys have to, the owners.
Yeah, sometimes yes, sometimes no. Just go with your gut. You can't go wrong by using a supplement product, right? You can't hurt them.
There you go. So Lisa said, mine just recently had a corneal abrasion, but she didn't say anything about it. And listen, I always say dogs and cats don't know the benefit of complaining, right?
No, squeaky wheel, man. You get more help that way.
Oh, I love it. Okay. So Fran says, thanks for doing this. My labs have punctuate cataracts, suspect not inherited. They were diagnosed on a routine OFA eye exam.
Great.
Would the antioxidants be beneficial with this type of cataract? Oh, from Davie, Florida.
Oh, great. So excellent question. So punctate cataracts, they're teeny tiny dip dots. So we can see that with our special microscope. And they'll usually be sitting somewhere in the peanut if you will, the nucleus, or sometimes kind of scattered about. So depending on where the location is, the ophthalmologist can tell you they're probably not going to do anything like progress or cause issues. However, your Labradors are still getting older. And so, yes, they will benefit just the natural aging process of the sclerosis. So I would say anyone would benefit in general. And I'm not saying we're going to get rid of your punctate cataracts. However, what we have seen, if a young dog gets a cataract that's a smattering, think of it like all the rings of the tree, right, of the chocolate, of the peanut M&M continue to grow, they'll eventually squish it and make it smaller, assuming that it didn't keep getting worse. So cataracts can get smaller in some cases. And I actually occasionally have seen a dog where I'm like, whoa, these eyes look great. There's no opacities. And the owner reminds me that I diagnosed teeny tiny cataracts the year before, and they had been on OcuGlow. So to me, that like blew me away. It's not every dog. I'm not going to promise that we cure cataracts by any stretch, but if they're early and you fix the problem, and diabetic cataracts, we did show that they slow, if not stop, the progression of diabetic cataracts. So if you put your diabetic on this right away, this pet should not go to fulminant quick onset of cataracts unless their sugar's like really crazy out of control. But if you can get them on this, at least there was a study and it's published that it slowed, if not stopped, the progression of the cataracts in a diabetic. So that's where I wish the diabetic patients would come to me early. I would love to not have to do surgery. That would be great. And I've seen dogs for years go without any cataract progression at all.
Okay, this is good. And in defense of us little GPs, that we don't know everything that's out there. We don't look at all these studies. We learn. We go to continuing education and we see, but it's always good.
And we forget. Like I've got some that like carry it, and they're like, oh, I always forget to mention that. Totally. Like because they don't see it in action. We see it in action. So
that's right. You see it every single day. All right. So Cindy says, my sweet girl went blind overnight at 10 years old. She was diagnosed with SARS. She never adjusted well, and her health really deteriorated over the next year. One of our fabulous vets came to the house. One of our vets came to the house and to let her go. So sorry, she was just talking about that. And
SARS is a tough disease.
Yeah, it is. I was like Black Cat. So we wrote Black Cat. Black Friday deals are still happening now.
Oh, that's good. We might have a sale, by the way.
I love this. Okay, so listen, I'm going to show everyone one more time the OcuGlow, and then my book, which is coming out in January. It's Never Long Enough. I have a whole vision section on managing pets with vision issues, and I mentioned OcuGlow in here as well. And I may need to have to make a little some addition edits to that because you gave me some great stuff out.
Cool. I have one idea that I didn't mention is if your pet has poor vision at night or in the darkness, put little night lights up, because remember your pet's down by your ankles or your knees, right? Not up here. So sometimes we have even lamps up here, but it's really dark down there and they just can't see.
Okay. So, I talk about night lights, but I never even thought about that. Like having it's not just timer lights up above, but have them down because that's where they are, right? Like go on the ground down there.
Same with hearing loss or starting to lose their hearing. Actually, so if they can hear, but they're blind and you're talking above them, people say, they look in my direction, but they seem lost. I'm like, yeah, because you're talking way up here and your voice is going over them. So try to click or do something lower or tap your foot to have them follow you.
Now, can I try to stump you with some trivia here? Because this is my only smart word that I've got that not many general practitioners know. Do you know the word for old age hearing loss?
Oh, no, I think you got me on that because my two dogs are deafer than hammers, and that's pretty much my term for it.
So what is the old age, like vision, or not old age, but vision loss? You said it earlier,
presbyopia. That's just, we're losing our up close vision because our lenses are too hard to move anymore.
So super close to that, it's presbycusis is old age hearing loss.
Ooh, presbycusis. Thank you. You taught me something. I'm going to use that. Presbycusis.
Listen, I had to have Google tell me how to pronounce that, so I'm not that smart. I love it.
I can't spell it. I'm a good speller. I don't know if I could spell that one, but I'll look it up.
I'm worse with it. Listen, I have taken up so much of your time, and I so appreciate everybody here is so thankful to have you and talking about the eyes. I think we focus so much on mobility and arthritis and joints, and we forget about these guys. The eyeballs are really important.
They are so important, and we should preserve them and take good care of them, every single one.
And I, my boy's been on this now for 6 months at least, and so and he'll come back, and I love to just get a nice little eye exam as often as possible, just like we should.
Absolutely, twice a year is what I recommend for anybody.
That's okay. That's interesting. Excellent.
They age faster, sadly, as we know. So 6 months to them is like a year to us. Or more.
You're right. I know. Yeah, you're right. So, all right. So twice a year. And if there are those of you who are in South Florida, we're up here in Jupiter. So, and now we know a really good orthopedic surgeon up here too,
yeah, we actually have 3 on our staff who are spectacular. So we're so blessed to have 3 great surgeons.
Okay. Good to know.
As well as all sorts of other stuff.
And a great physical therapy department, I must say, because
they're amazing. Yeah,
they are amazing. Took care of my girl. So 3 times a week she was there. I was sitting in your parking lot. Aww. So I was.
Oh, they got 5 pounds off my fat cat and with underwater treadmill.
No way.
Mm-hmm.
Oh my
She loved
goodness.
it.
See, okay, I love this. I'm gonna have to try Dr. Yang to come on here too one day and talk.
Oh, she'd be great. Yes.
Yeah. I love it. All right. Well, thank you so very much for being here. I so appreciate it. I know you're a busy bee, so I'll let you get back to work. And thank you.
Anytime.
Anytime.
I have enjoyed it very much.
Good. All right. Take care. Bye, everybody.
Bye.